Hi everyone! Did you know that this month we celebrate our felines' health as well as our pets' dental health to keep those happy smiles? This will be interesting as we have Dr. Amber to guide us along.
That's right, Donnie. We're going to discuss why dental health is so essential for your pet. I'll share some easy to follow tips and strategies on how to take care of your pet's teeth. February is also Spay and Neuter Awareness Month, so we'll talk about why it's so important for preventing unplanned pregnancies, unwanted litters, and reducing pet overpopulation.
Let's get started. This is Donnie, the co-founder and CEO of Vital Pet Life.
And I'm Dr. Amber, your official veterinarian at Vital Pet Life.
We're here to talk about pets, pet nutrition and wellness, anything that can help our fur children live a longer, vibrant, and happier lives.
All right.
Yeah. Welcome to Vital Pet Life Podcast.
So Dr. Amber, can you please give us maybe just like a brief reasoning why dental cleaning and oral care to our canines and maybe felines is very important?
That's a great question. I think a lot of people think it's just, I don't want my dog breathing bad breath in my face, which of course nobody wants that, but it goes so much deeper than that. Dental health is important for overall health. If your pet has an infection in its mouth, it really affects their organs, it affects their overall health. And so it's important not only just for the mouth, but the overall well-being of our pets.
Okay, so I have another question. Like, how often do I need to clean it? Is it something how we clean our teeth? Sometimes we do like twice a day, the moment we're up or the moment we go to bed. It's really hard to just let them open their mouth.
Right.
Yeah. So
yeah.
How often?
That's a great question. When they're young is the best time, obviously, to start training. Even when they have puppy teeth and kitten teeth, and they're going to lose those teeth and get their adult teeth. But if we can start getting them used to having a toothbrush or those little brushes that fit over the finger with the tiny rubbery fingers, those are great. They're less invasive, I feel like, than, a toothbrush sticking it in their mouth. Starting when they're young, training dogs and cats, there's toothpaste on the market that has a good flavor for them. So like poultry flavored toothpaste, which sounds disgusting to me, but, would be really tasty for dogs and cats. And then just consistency. So when I was in vet school, I got a dog from a family member. She was about 8 years old when I got her, had never had her teeth brushed. And but she was super food motivated. So the way that I trained her to allow me to brush her teeth is I would brush her teeth and then feed her dinner. And so it was like this instant reward. She would sit there and get her teeth brushed, and then she would sit down and be able to eat. So whatever you can use as far as positive training techniques to get your dog to accept it. And sometimes it might be, let's just touch the face with the toothbrush and not even touch the teeth at first, just little baby steps. Yeah. Because honestly, like most dogs and cats are not going to let you just shove a toothbrush in their mouth and start brushing. Once they're trained and they allow you to do it, try to do it every single day and then get a good 30 seconds on the outside of the teeth, on the inside of the teeth, top and bottom. So try to cover every single surface.
Yeah, I tried doing that with the little puppy. Tuxedo, it's kind of hard. So Kyle's the only one that can really touch his face. And it's funny, he had 2 front teeth taken out last week. So I went through that whole dental.
And then I think you asked about, how often maybe a dental cleaning needs to be done. So that's really based on the patient. Obviously, with good oral care at home. So if we're brushing the teeth on a regular basis, we're feeding a dental diet, we're doing water additives, we're doing all the right things, then we may be able to stretch out that time in between a dental cleaning. I will say most, if not all, pets will need a dental cleaning periodically. Some pets will need one every single year. I've seen some that just build up tartar like crazy and need one every 6 months.
Oh my gosh.
And sometimes they can go 4 or 5 years. That kind of segues into what to watch for. How do we know if our pet needs a dental cleaning? Yeah, signs of dental disease. One of the earliest first signs you'll see is that bad breath. You know, you may look at their teeth and like, gosh, it doesn't look that bad. But if they have a smell, then that's a sign of dental disease. Beyond that, you can see tartar. So that's the hard minerals that attach to the teeth. And let me just say, the reason why we recommend brushing every single day is that they'll get plaque on their teeth, which is like this soft, kind of slimy, gummy film that hardens into tartar after 24 hours. So if we're brushing every day, we're really decreasing the amount of tartar that's going to build up over time. So that's why we say 24 hours. But once there's tartar there, we can't get that off with just a regular brushing. It's like a rock. Okay, so tartar, you're going to see red gums. So gums should just be a nice pink color. But if you see a red line around, that's sign of inflammation. And then definitely if you see bleeding, that's abnormal. Injuries happen. They're chewing on something. They kind of scrape their gums. But if it's like you can barely touch them and they start bleeding, that's definitely abnormal and a sign of infection. That's gingivitis, so an inflammation in the gum tissue. And then you'll see drooling, like later on in the course of dental disease, drooling, pawing at the mouth, kind of gnashing their teeth, if that makes sense. You know, I've seen especially cats kind of like chew weird, like nothing's in their mouth, but they're kind of gnawing on nothing.
Is the nibbling also something? Because that's what I noticed at tuxedo, like nibbles.
Yeah.
And then I think it might be painful.
Yeah, for sure.
That's why I've been really resisting to go because I was so scared because he was older. I mean, he just turned 12 and I'm like, I'm kind of worried for Tuxie. I guess now he feels so much better that the tooth was taken out.
Right.
I think it was hurting him.
Yeah. Absolutely. I mean, anything like behavioral changes or they're chewing on weird stuff, any of that can be a sign of dental disease. Definitely if you see them having a difficulty eating or they have loose teeth, I mean, that's a sign of very severe dental disease, very advanced bone loss. And so we think about those dental cleanings and they're not cheap. Just a regular dental cleaning without any tooth extractions can be expensive. You know, you look at the blood work, the anesthesia, the time of doing the dental cleaning. But if you add on extractions, sutures in the mouth, it's just exponentially more expensive when they have bad dental disease. In this case, it really is better to prevent. If you've been listening to our podcast for any amount of time, you know that we love to do things that prevent more serious illness. And so dental cleaning is really, really important. And like you said, sometimes I've had patients that came in and maybe didn't have horrible dental disease, but then after we got their teeth cleaned, the owners were like, wow, I actually had a client that said, I didn't think my cat was sick. And then after the dental cleaning, he's like a whole new cat. And it inspired me to go get my teeth cleaned too, because it's been a while. And so it's really slowly progressive. And so sometimes they're getting sicker and sicker so slowly that we don't notice. And so it is just very important to keep their mouth as healthy as we can.
I mean, you mentioned about a cat client. So my question to that, is there a difference between a cat dental care and a dog care? I mean, I know they don't have the same tooth, I guess. The feline probably is tiny, or I have no idea.
Yeah. The signs are really similar. The dental care is the same, but the way that cat dental disease and dog dental disease progresses, a little bit different. So in dogs, they get that plaque and then that tartar, and it's filled with bacteria. So the enzymes in the bacteria damage the gums, damages the periodontal ligament, which is that ligament that holds the tooth in the socket. Then you get bone loss. That's the typical progression of dog dental disease. Where cats, they actually don't have to have a lot or any tartar. Sometimes they just react to that plaque, that slimy biofilm on the teeth. And so even in really young cats, you can see that red line around their gums. You can see that gingivitis. And it's almost like the cat's body reacts to the plaque and the tartar as if it were a foreign object. And so it's like this immune response that they get to that. It is a little bit different between dogs and cats. Like I said, the at-home care is pretty much the same. Dental cleanings are pretty similar between dogs and cats, but the progression is is a little bit different. The other thing that cats get that dogs can't think of one case I've seen, they're called resorptive lesions. And so it's actually little holes that form. They're not the same as cavities that people get, but it's actually the enamel gets eaten away down to the root cavity. And so you'll have this hole in the tooth.
Oh gosh, it must be painful.
It is very painful. I've seen cats who are under anesthesia for a dental cleaning, and you touch that spot and their little jaws are chattering. Like they're so sensitive. Honestly, I think dogs and cats, like they don't have a choice. They still have to eat. And so sometimes the signs are pretty subtle. They'll still be eating, but they have this painful mouth. And so it is really important that when you take them in for their yearly exam, that the vet is doing a really good dental exam. Follow the recommendations. I mean, if they need a dental cleaning, if the vet sees those resorptive lesion in cats, they're just so painful. That's not a good way to live. And so they really do need to have those teeth extracted to be comfortable.
What about probiotics? Like I read, or there's recent studies that shows that certain probiotics can improve oral health.
Yeah.
Do you recommend that?
Yeah, I think probiotics are great for overall health. I mean, it's more obvious with gut health, but we know like there's organisms that live all over outside of our bodies and inside of our bodies that are there to keep us healthy. I just looked up a study that was published last year in the Journal of Animal Science that looked at specifically probiotics for oral health, and it did show lots of benefits. So it showed that there was a better healthy population of bacteria in the mouth. There was less plaque and tartar buildup because some of those healthy bacteria actually killed the bad bacteria and decreased the toxins that lead to that gum loss and periodontal disease. Probiotics just in general and in the gut, they modulate the immune response. So they kind of normalize the immune response, if you will, because so much of dental disease is an inflammatory response to those toxins and the bacteria that are in the mouth. And it actually, the study did show that it improved the inflammatory response in the mouth. So, you know, Donnie, you and I, we talk about probiotics. We only know like the tip of the iceberg. I think there's so many benefits that we just don't know yet. But yeah, this was just a study that came out a few months ago.
Oh, that's interesting.
Yeah.
Well, I'm excited. I feel there's going to be more research and more discoveries on how probiotics are prebiotic or postbiotics. Like all those pre, pro, and post. Will be able to help not just our animals, but also for us. I feel like the gut is a different organ, you know? Like it's the brains in the gut.
I mean, it's kind of like I'm starting, the more I read and the more I learn about it, I'm starting to think like the gut is the center of our entire well-being, like our entire health. And so I'm excited for, you know, what we learn in the future about probiotics.
Me too. Thank you, Dr. Amber.
So this month is also Spay and Neuter Awareness Month. So we'd like to talk about that and how important it is to spay and neuter our pets.
Yeah, we always talk about it. And I think that we even have an episode talking about why it's very important to have our animals like spay and neuter and why do we need it. I mean, I know it's kind of scary to think about, like, is it safe? It's a routine surgery, right? Like everybody does it. Nothing to be scared at.
Right. I mean, and don't get me wrong, it is a surgery. It's anesthesia. For females, you know, we're doing an abdominal incision. So we're going into their abdominal cavity. A little bit harder for females than males because of that. For males, you know, we're just making a surface incision in the skin. We're not going into the abdomen. If their testicles are where they should be. There's always risks to surgery and anesthesia. The good thing is that most veterinarians have done hundreds, if not thousands of spays and neuters, even like the low cost, high quality spay and neuter clinics that you can find, you know, I mean, those doctors do like 100 a day. I don't know, maybe I'm exaggerating, but they do a lot. And so most of the time it is a very routine procedure. It's important to spay and neuter because of the pet population. So last year there were almost almost 1 million. This is only the ones that were counted. The ASPCA, I looked this up. Almost 1 million healthy animals were euthanized in shelters last year.
Oh, God.
And so that's a really sobering figure. You know, you think about how many of those litters were accidental, and then those pets didn't find homes. They went into shelters and they were euthanized, even though they were perfectly healthy.
Or maybe they found homes and they were relinquished. And
yeah, right.
It's so sad.
Yeah, we never know the situation. We totally understand that, you know, not everybody can have a pet, or sometimes the pet is not a good fit for your family. We understand all that, and we're not trying to judge on that. But if we can decrease that number just by spaying, like if you're not going to breed your dog, if they're not a purebred dog and you're not planning on having a litter, just get them spayed.
You don't want to be a backyard breeder.
Backyard breeder. Yeah, I guess that's a whole other topic we could talk about. But
oh my God.
I really think it's important to be aware of that. And they can get pregnant as early as 6 months. 6 months is usually the time where they'll go through their first heat cycle. In bigger, larger breed dogs, it can be like 9 to 12 months, but they can get pregnant on their very first heat cycle. And you never know if, you know, a neighborhood dog that's not neutered will jump the fence and then your dog is pregnant. Like it can just happen so easily.
I mean, it's nature.
Yeah.
First, I didn't really understand because, like, I was one of those pet parents. Like, I experienced it that I was so scared to spay and neuter my dogs. And I had a male Shih Tzu and a female Maltese mixed dog, and they ended up having babies. And I ended up like keeping 3 of them. And then the other 3 was rehomed to family members that wanted to have them. I mean, luckily, and then after that, okay, I'm gonna spay and neuter the guys, but including the babies, like the one that I kept. I think too, to my understanding, it also gives them not just prevent more litters, but at the same time, it's pretty much helping the health of the animal too, how they live. I realized that spaying for female basically helps with
pyometra. So pyometra is a life-threatening infection in the uterus. So they usually develop it. It's hormonally based. So as their hormones fluctuate after their heat cycle, then they can get this infection. And of course, as they age, the risk of pyometra goes up. But basically, once they have pyometra, there's nothing you can do except surgery. And so instead of having a routine spay, it's a dangerous, risky surgery, depending on how long it's been going on. Yeah, how advanced it is. You know, sometimes you catch it early. Other times the uterus is about to rupture. It's so filled with pus. And these dogs are really sick. So they're poor candidates for anesthesia. But if you don't do surgery, they're going to die. And so we can remove that if we just spay them at a young age. It's not only dangerous, but it's much more expensive. You think about the cost of a spay in a young, healthy puppy versus an older dog that's already sick, that has this massive infection, that's going to need all this extra care and this emergency surgery. It's so much less expensive and easier to prevent than to treat when they're really sick.
And also, like, healing time with a younger puppy takes pretty fast. Again, I'm one of those pet parents that are really nervous, that I will really sit down and really like, okay, I'm gonna take care of you. But yeah, it just takes a week or two, and make sure to put the cone on so that they can click the scars or the area that, so.
And in my experience, you know, we always tell owners, like, keep them really quiet for 10 to 14 days, try not to let them be too active. Oh my gosh, most of those puppies by the next day, they're just bouncing all around. They bounce back really fast. If they're young and healthy, it's a really quick recovery, and they feel too good usually. We need to kind of keep them restrained for a couple of weeks, but really easy process typically, versus again, if they're older, if they're sick, if they've got this pyometra, like, they're much longer healing times for that. The other thing that we're preventing is cancers later on down the road. So obviously in males, we can have testicular cancer. I've seen older males who are not neutered that have prostate problems, and that's almost unheard of in dogs that are neutered. I've actually seen a few patients that like an emergency neuter because their prostates got so big, they couldn't poop, they were having a hard time peeing. Again, like, they were already really sick, and then you do this neuter procedure to save their lives, to try try to relieve that suffering. And so let's prevent that. Let's do it younger. So that's something that can happen in males. In females, we're preventing mammary cancers, so breast cancer. If dogs are spayed when they're puppies, before they even go through a heat cycle, they have almost a 0% risk of mammary tumors. It's
really?
like 0.5% will get mammary tumors if they've been spayed before they had a heat cycle. So if they go through one heat cycle, their risk is about 8%. And if they go through 2 heat cycles, their risk is about 26%. So it goes up exponentially. After they've gone through their second heat cycle, you spay them, their risk doesn't go away. In larger breed dogs, we used to say everybody should be spayed at 6 months old. But now some of the more recent research that's come out in the last couple of decades says that it's actually better for large breed dogs to reach their full mature size before we spay them. It seems to, if we're spaying those large breed dogs too young, they tend to have a higher risk of orthopedic problems in the future because it prolongs. If we spay them too early, their growth plates are open for longer. They just tend to have more orthopedic problems. So in large breed dogs, we're saying, probably at least a year old, which means that they may go through one heat cycle before we get them spayed. So we know that it increases their risk a little bit, and we just need to be careful in monitoring that. So one thing to look for, you're going to feel the lump in the mammary, like right under the nipple. They're hard, they're really firm. And sometimes if you catch them small, obviously you have a better chance of getting them removed with surgery. Yeah. And about 50% of them are cancerous and the other half are benign. And you don't usually know that until after surgery. Like if I saw a dog with a mammary tumor, I would recommend surgery, and then you send it off to pathology to find out if it's benign or malignant. And they can actually be mixed. They can have some non-cancerous cells and they can have cancerous cells. So they're kind of tricky things, but again, mostly preventable with spaying before their first heat cycle, and then mostly treatable if you catch them really early, if they do develop a mammary tumor.
Can I have a question on that? Like for bigger dogs, let's say a husky, and do you know like at what age do these big dogs, or let's say like a doodle or lab, reaches their full desired weight and size? What if it's over 6 months, like for a female, let's say? So they go through the first heat cycle.
Yeah, it kind of varies a little bit, but usually large breed dogs will go through their first heat cycle between 9 and 12 months old. They're usually full grown at about 12 months old. So if you wait a full year and then spay them, you may catch them before their first heat cycle, but they may have gone through one before you spay them. But have that conversation with your vet too. I've had that conversation with plenty of clients. Like, these are the risks, these are the benefits. If you want to spay them when they're 9 months old before they went through their first heat cycle and they're almost full grown, that's probably okay, but that's kind of a personal decision, and being fully informed, talking to your vet, and making the best decision for your pet.
Okay, so I think the takeaways here, first, for the spay and neuter, it really depends on the size of the animal, and always talk to your vet. It's better to have it when they're younger because they're healthier. And then second, if they're like a bigger breed, wait till they reach the full size to mitigate like orthopedic issues. And then the other thing about dental cleaning, it's really important if you have a puppy, or to introduce like dental cleaning into the routine of your dog earlier, so that they won't feel stressed out and it's like normal to them. And they're just like us, like how we take care about our bodies, our teeth and health, it just translates to our pets, their family. We want it to be healthy, and I think we want them to be healthy too.
Yeah, absolutely. And my takeaway is that it's so much easier to prevent something than treat it later on. It's better on the pet, better on our pocketbooks. And so,
also in the mind, like, oh gosh, like the stress and anxiety, better for everyone. Well, thank you everyone who tuned in today. This was an especially informative episode because I know as pet parents, we all wonder and worry about our pets' dental health and about spay and neutering. Please feel free to share these pet tips with other pet parents. Don't forget to click the follow button so that you'll be notified about our new weekly episodes.
This is Dr. Amber. Thanks again for listening to this episode on dental health as well as spaying and neutering. Let us know if you have a tip or trick that has worked for you and your pet. We answer all of your questions at the end of every Break It Down with Dr. Amber episode, so tune in to hear the questions answered. Email us at podcast@vitalpetlife.com. Thanks again and have a fantastic week.